So how long does lip filler last? I'm Becca, an aesthetic nurse offering hints and tips for aesthetic treatments. Follow for more. So when asking how long lip filler lasts, typically most people will answer with around about approximately 6 to 9 months or 6 to 12 months. This will vary depending on the type of product used and the brand of filler. Because the lips are quite a mobile muscle, we obviously use the lips to talk, to eat, to express emotions. So therefore it is a very active muscle, which makes it more likely for filler to break down a little bit more quickly compared with other static areas, for instance, the cheeks, the jawline. Therefore, because of this, most aesthetic clinics will invite their patients back in around about 12 months' time to refresh that filler, which is quite common in practice. However, over the past few years, there's been a lot more evidence mounting that filler might be sticking around a great deal longer than we actually thought. So there has been an incident where a radiologist has performed an MRI scan and found residual filler from around 2 years up to 12 years old that's still present. Obviously, it's really important to understand that filler degrades at different rates with different people, and there's so many factors that can influence that. It's a really positive sign, in my opinion, because then it means that we don't have to be in this mindset of having a repeated filler treatment every 6 to 12 months. For example, a lot of people, it is ingrained in them that they have the lips done, 6 months later they'll book back in and have a refresh. So for one, it's better for the patient's pocket, because then that means that they're not having to pull out for that treatment. For two, it means they can then focus on other areas. So personally, one area that I would suggest would be skincare. Investing in good medical grade skincare can have a huge impact on anti-aging or slowing down the process of aging. Although there are other considerations to think about as well. So because filler can last a lot longer than we first anticipated, it can also mean that if it's hanging around in our face a lot longer, then there's a higher risk of things going wrong if they aren't done properly, which again makes it even more important for people to be placing fillers in the right place, to be doing it in a sterile way too. So when my patients ask in clinic how long will this last, I generally explain to patients that the guidance suggests that it should last between 6 to 12 months. However, I recommend that my patients assess closer to that time period, and if they're unsure as to whether that filler has naturally degraded, to come into clinic, have a consultation, and then I can give my recommendation as to whether I feel that filler would be appropriate